Welcome to the TMHP YouTube channel. In this video, we'll explain how to successfully enroll with an atypical provider identifier, or API, as a children with special healthcare needs, or CSHCN, family support services, or FSS provider. If you need additional help from a TMHP call center representative, call the number 800-925-9126. For access to additional resources, such as FSS request forms, click on the link found in the description. Here's a list of all the CSHCN FSS provider types that are expected to use the new PEAM system. Respite care providers allow caretakers a short break from caring for their child. Home modification providers provide services including installations such as ramps, roll-in showers, or wider doorways. Vehicle modification providers provide services including installations like wheelchair lifts and related modifications such as wheelchair tie-downs, raised roofs, and hand controls. Home inspectors work with home modification providers to ensure that installations are completed properly and effectively. These services can help families care for clients with special health care needs. FSS can also help a client become more independent and makes it easier for them to take part in family life and community activities. Note: all FSS provider types are required to attach Form 4109, Application for Texas Identification Number, to their enrollment. Although it's optional, it's recommended that providers attach Direct Deposit Form 74176 in order to opt into the EFT program. You can find these documents on the Health and Human Services website. Now, let's look at a high-level diagram that explains the enrollment process for each FSS provider type. First, we'll start with respite care. Step 1. All family support services must have prior authorization by the CSHCN Services Program. This means that the caregiver must receive written authorization from the program before they can provide family support services to a child or family member enrolled in the program. Providers are only reimbursed for respite services that have been authorized. Step 2. The CSHCN FSS program can only pay for services from providers enrolled in the program. To enroll, a provider must enroll with TMHP's Provider Enrollment and Management System, also known as PEAMS. FSS providers must use PEAMS in order to enroll as a Medicaid provider. If you haven't previously enrolled into Texas Medicaid in the past, you will need to set up a portal security account before accessing PEAMS. Step 3. Complete your Medicaid enrollment through PEAMS. Important: respite providers working through home health agencies will need to complete TMHP's disclosure of ownership and control interest statement. Once you've submitted your application, HHSC and/or OIG will review it. From this point on, the client's social worker will remain in contact with you every step of the way. In summary, contract applicants and contractors will use PEAMS to enroll in or revalidate as a Texas Medicaid provider to obtain or retain a contract with HHSC. You will still need to go through the HHSC process to contract with a specific service separately. Our next diagram explains the enrollment process for home and vehicle modification providers. Step 1. All family support services must have prior authorization by the CSHCN Services Program. This means that the contractor must receive written authorization from the program before they can provide family support services to a child or family member enrolled in the program. Before a modification can be authorized, contractors will need to submit their bid to the family. Providers are only reimbursed for modification services that have been authorized. Step 2. The contractor is notified if the CSHCN Services Program approves their bid. Step 3. The CSHCN FSS program can only pay for services from providers enrolled in the program. To enroll, a provider must enroll with TMHP's Provider Enrollment and Management System, also known as PEMS. FSS providers must use PEMS in order to enroll as a Medicaid provider. If you haven't previously enrolled into Texas Medicaid in the past, you will need to set up a portal security account before accessing PEMS. Step 4. Complete your Medicaid enrollment through PEMS. Important: all home modification providers need to submit proof of general liability coverage when enrolling with PEMS. Once you've submitted your application, HHSC and/or OIG will review it. From this point on, the client's social worker will remain in contact with you every step of the way. In summary, contract applicants and contractors will use PEMS to enroll in or revalidate as a Texas Medicaid provider to obtain or retain a contract with HHSC. You will still need to go through the HHSC process to contract with a specific service separately. Our last diagram explains the enrollment process for home inspector providers. Step 1. Home inspectors should enroll in Medicaid as soon as possible so that they are publicly listed as an enrolled CSHCN services program provider. This will make it easier for home inspectors to receive work immediately. To enroll in the CSHCN services program, a provider must enroll with TMHP's Provider Enrollment and Management System, also known as PEMS. FSS providers must use PEMS in order to enroll as a Medicaid provider. If you haven't previously enrolled into Texas Medicaid in the past, you will need to set up a portal security account before accessing PEMS. Important: home inspectors must be independent of the contractor who is doing the home modification and must be licensed as a home inspector through the Texas Real Estate Commission, TREC, or the Texas Department of Licensing and Regulation, TDLR, as a registered accessibility specialist, also known as RAS. Step 2. Complete your Medicaid enrollment through PEMS. Once you've submitted your application, HHSC and/or OIG will review it. Step 3. All family support services must have prior authorization by the CSHCN Services Program. This means that the inspector must receive written authorization from the program before they can provide family support services to a child or family member enrolled in the program. Providers are only reimbursed for modification services that have been authorized. From this point on, the client's social worker will remain in contact with you every step of the way. In summary, contract applicants and contractors will use PEMS to enroll in or revalidate as a Texas Medicaid provider to obtain or retain a contract with HHSC. You will still need to go through the HHSC process to contract with a specific service separately. Now that we've completed a brief overview of each provider type's process, let's walk through the API enrollment process in PEMS. First, you'll need to create a provider enrollment account. Go to tmhp.com and click My Account. The sign-in box will pop up. Click Cancel in the sign-in pop-up box. The My Account page will now open. Click Activate My Account, then click Go. The Why are you creating a new account page will open. Click Create a Provider Enrollment Account, then click Next. The Create New Account page will open. Complete the fields that are marked with a red asterisk. Read the general terms and conditions and click the checkbox next to the statement, I agree to these terms. Click the checkbox to confirm that you're not a robot and click Submit. You now have a provider enrollment account. You will get 3 confirmation emails. Read all 3 emails before you move on to the next steps. Now you can finish your CSHCN FSS enrollment. Go back to tmhp.com and click My Account. Enter your username and password and click Sign In. The My Account page will open. In My Account, go to the Manage Provider Account section and click Provider Enrollment and Management System. Now that you're logged into PEAMS, click Start New Enrollment to begin. Take a moment to read all the information on the page. When you're ready, click Continue. Select Enroll as an atypical provider. Note, the View Instructions button can be found at the bottom of each page throughout the enrollment application. Clicking this will take you to the PEAMS instructional site. You can leverage the PEAMS instructional site whenever you need help with your enrollment. Use the page filters on the left to customize your instructions to your provider type. Here's a list of all the different enrollments each provider type can initiate. Home health agencies that provide respite care, home modification providers, or vehicle modification providers can select an organization API type and enroll as a facility. Respite care providers that are not a part of a home health agency and home inspectors will select an individual API type and enroll as an individual. If you need additional help from a TMHP call center representative, call the number 800-925-9126. If you are enrolling as an organization, you will need to provide your tax identification number. If you are enrolling as an individual, you will need to provide your Social Security number. Read the Texas privacy statement. Click the checkbox next to the statement, I have read and agree to the Texas privacy statement and laws. Click Begin Enrollment/Registration. You have now successfully initiated your Medicaid enrollment. The first section of your enrollment is Services Provided. To add a service, click the Add Services Provided button. You must fill out any field with a red asterisk throughout the enrollment. Important. Verify that your address is correct. When you enter an address, our system will check to see if it shows up on a map. If we can't find it, but you still want to use it, click the Continue with Address Entered checkbox. Under Program Participation, locate the Program dropdown. Make sure to select Children with Special Healthcare Needs, Family Support Services, or CSHCN FSS. Let's continue to the next section. Click Provider Information on the left-hand navigation panel. Continue to fill out essential fields and verify your information as needed. Next, let's head to Licenses, Certifications, Accreditations. Click the Add Licenses, Certifications, Accreditations button. You may need to submit licensing information depending on your provider type. For example, if you are enrolling as a home inspector, you must be licensed as a home inspector and provide your licensing information. You can attach an image of your license at the bottom of the page. Let's move on to the Disclosure section. If you click Yes on any of the following questions, you may be asked more questions. Click Save before moving to the next section, Accounting, Billing. Click the Add Accounting Billing Information button. Fill out any field with a red asterisk and enter the address where you want TMHP to send your checks and tax statements. Click Accounting Billing to go to the next subsection. Our system will automatically fill out the information that you provided on previous pages. You must fill out the remaining information. If you need help filling out your W-9 form, go to www.irs.gov/form W-9. Let's go to the last subsection, EFT. CSHCN FSS providers are not required to enroll into the EFT program, but if you choose to opt in, you'll need to attach Direct Deposit Form 74176 in a later section. If you don't want to opt in, click the checkbox to confirm that you do not wish to participate in the EFT program. Once you're finished, click the back arrow to navigate back to the main accounting billing section. The next section is the Ownership Controlling Interest section. If the new enrollment is initiated by an organization, then this section will be populated and you will need to fill it out. If the new enrollment is initiated by an individual, then this section will not be visible. Let's move on to the next section, Programs. Locate the CSHCN FSS program and click the Yes Radio button. Next, click the Practice Location Information section. For each new practice location, click Add Practice Location to add each address at which you render services. Our next section is Application Fee. However, CSHCN FSS providers are not required to submit one. Let's skip this section and move on to Attachments. You can upload all your required documents on the Attachments page. All CSHCN FSS providers must attach Form 4109, Application for Texas Identification Number. Home and vehicle modification providers will need to attach their general liability insurance. Now, let's head to our last section, Agreements. You must electronically sign the HHSC enrollment agreement before you can submit your enrollment application. If you choose to use direct deposit, you must also sign an additional agreement. After you sign the agreement, verify that you've completed everything. If everything is complete, click Submit. Now that your enrollment has been submitted, TMHP will review it and send you an email that tells you if it was approved or denied. Reminder, if you need additional help from a TMHP call center representative, call the number 800-925-9126.